The following video presentation has been produced by Cascade Orthopedic Supply to introduce you to the Cascade Up and About casting device and the Up and About casting procedure. The Cascade Up and About casting device is a compact and portable unit designed specifically to assist the orthotist during the casting procedure of Up and About KAFO molds. Like the Up and About system itself, this casting device has been designed to be extremely strong, lightweight, and easy to use, and most importantly, it helps in providing a healthier and more comfortable life for the paraplegic. To assemble the unit's main components, simply follow the instructions found on the lid inside the case. The use of this device will simplify the casting procedure while still maintaining exact casting parameters, thus aiding the orthotist to produce molds with correct toe-out, stance width, and dorsiflexion angle suitable for the Up and About KAFO fabrication, requiring minimal cast modification. With its modular construction and the use of simple fasteners, assembly and disassembly of the Up and About casting device makes transporting the unit an easy task. To set up the device and for the casting of the patient, a treatment table or other similar flat surface is recommended. Select the appropriate subperineal spacer, child, adult, or adult-wide. Attach the spacer to the carrier with the black socket head cap screw provided. To assemble the footshell dorsiflexion wedge, attach the clear footshell positioning support with the black machine screws, washers, and small knobs. Be sure to leave these loose, as the dorsiflexion wedge will slip in between the footshell and the foot positioning support. With the patient's measurement chart in hand, adjust the predetermined dorsiflexion angle on the casting device. Keep in mind that the dorsiflexion angle must be 2 to 5 degrees. This setting is obtained by inserting the dorsiflexion wedge as shown until the desired angle is achieved. The 5-degree maximum has been reached when the fork of the wedge is 1/2 inch below the lower bolt of the foot positioning support. Be sure you do not go beyond this point. To attain the proper perineum to floor measurement, slide the subperineal spacer to a position on the casting device equal to the patient's perineum to floor measurement minus 15 to 20 millimeters. Depending on the patient's height, it may also be necessary to adjust the stance width section of the center frame rail. To check the patient's stance width settings, refer to the horizontal stance width datum line while making your adjustments. Finally, the cushion pad which supports the patient's upper torso during the casting process is snapped onto the upper crossbar and secured to the carrier with a black socket head cap screw and washer. Prior to casting, explain the process to the patient, take them through a dry run, and answer any questions they may have. To prepare the limbs for casting, place surgical tubing as seen here along the entire length of each limb to facilitate the cast removal. Next, apply the appropriate size stockinette over the limb and identify and mark the bony prominences with an indelible pencil. With the patient relaxed and lying supine on the casting device, examine the knees for full extension, making sure the footshell heels are firmly resting against the carrier plate and that the subperineal spacer is in its proper position. While holding the leg to one side of the casting device and starting at the toe, begin applying regular set plaster bandage or other appropriate casting material to a thickness of 2 or 3 layers on each leg. Apply the plaster wrap to a level equal to or greater than the level of the perineum. The Up and About casting device elevates the patient approximately 3 inches above the casting surface, providing clearance during the application of the casting materials. After the casting material has been applied and smoothed, insert the foot into the clear foot shell. Check to be sure the heel is flush and firmly positioned in the foot shell. Next, secure the foot with the ankle strap and proceed to wrap the other leg. After the casts have cured, mark them as seen here for accurate reassembly. Now proceed to cut along the ridge created by the surgical tubing with the cast saw. Spread the cast carefully, and now slowly remove it from the patient. Once off, the cast should be aligned using the key markings drawn earlier, taped together, filled with plaster, and allowed to set. Provided the up and about casting device has been used correctly, the only cast modifications needed are plaster buildups to the bony prominences. The use of Cascade's up and about casting device will not only help keep the patient comfortable during the casting process, but also assist the orthotist by keeping the limbs accessible and in their prescribed position without excessive manipulation.